An issue that became a statewide conversation, really a regional conversation over the last couple of weeks, was the announcement that Brown Health was considering closing the birthing center at Newport Hospital. And this is significant for a lot of reasons. Number one, I mean, look, you do that, all of a sudden, you don't have people born in Newport. So you lose the whole born and raised in Newport aspect of things. There's also a lot of practical implications for this. I mean, take a look at fire or rescue apparatus. And if you have a situation where someone needs ambulance transportation to a birthing center, perhaps in Providence, you now take an apparatus offline, so to speak, in Newport. This obviously affects the entire island, not just Newport, the city of Newport. It's an Aquinic Island writ large conversation. There are options. There are, quasi birthing centers in South County, but that's really not much closer than Providence. And when you factor in the Washington Bridge and typical traffic that can occur, this becomes one of those scenarios that has the potential for disaster. Fortunately, Brown Health reversed course after a lot of conversation, media attention, and outpouring of community voicing on this issue. But it doesn't necessarily mean that this won't come up again. And you ask yourself the question, what kind of world do you want to live in? Cassie, I guess if you want to introduce yourself and explain how you're involved in this and the organization that has really been driving this conversation from a civilian standpoint.
Yeah, absolutely. Hi, my name is Cassie Voll, and I'm one of the co-founders of Moms Over Margins, which is a local advocacy group that was founded just a couple weeks ago, kind of in the wake of the news from Brown University Health that they were considering closing the birthing center at Newport Hospital. My co-founder, Brooke Cure, and I, we both delivered our sons, who are right around the age of 2 right now, at Newport Hospital. And so this obviously has a huge impact on us personally. We both had just really wonderful experiences delivering our sons at the hospital. The birthing center has incredibly well-trained, incredibly compassionate staff that is, bar none. And the OBs there are just, again, really compassionate, really well-trained. And to lose, like you said, Bill, have such a devastating impact on the entire community, but like you said as well, the entire state at large. The birthing centers at South County, which, without traffic is about a 30-minute drive from downtown Newport, would, mean that there would be women delivering potentially on the side of the road, because when you go into labor, you never exactly know how long you have before the baby's going to come. So we have that. We also have especially, and this kind of ties into the proposed RIPTA cuts that are kind of on the docket as well. Those without transportation would have to travel incredibly long distances, sometimes, perhaps on services that may no longer be offered. That is a conversation for another day, as well as, like you said, tying up our emergency services, which then has a knock-on impact of, reducing the emergency responders that are available for the rest of Aquidneck Island. So, even if you're, say in your 60s and you're saying, oh, this isn't going to impact me, it can, because the volume of emergency deliveries that are going to have to be taken care of by our first responders and, transporting these people to South County or Kent or Women's and Infants in Providence is going to significantly tie up, those people and the response times.
No question about it. It's a practical issue. You mentioned RIPTA, and I think there's a lot of intersectionality here in a lot of different spaces, and that includes public transit, and that includes a broad conversation on access and equity. And this was an inequitable decision when it came down from Brown. It just further illustrates the corporatocracy that really runs our lives, and decisions made not on what's best for community, but what's best for profits, for private sector oligarchs, quite frankly. I mean, that's really what this was. This was not about, well, this is best for the community. This was about money. So with that being the case, what were the arguments that you used and your organization used to convince Brown that, this might not be best from a financial standpoint for you, but it's something that is the right thing to do?
Well, I think a lot of the reasons that we've just cited, including, just putting it very bluntly, if the birthing center's birthing center closes in Newport, mothers and infants could die. They could die because they don't have the immediate access to care that they need. They have to travel those long distances. And, the emergency department at Newport Hospital, again, very highly trained staff, but they are not trained to deliver babies. That's not what emergency departments are for. So, I think that when we were trying to make these arguments, we were really focusing on the community aspect of it, of, our organization name is Moms Over Margins. So that means we're going to value the lives and the healthcare of our mothers over, the corporate profit that is to be had. And so I think really focusing on that, focusing on, again, the effects throughout the community, the ripple effects throughout the community, the ripple effects throughout the entire state. And of course, the support from all of our local politicians, our state politicians, and our federal level politicians, including Senator Whitehouse and Congressman Amo, really helped to move the needle with getting them to listen to our position on this.
Governor McKee took a victory lap on the day that there was scheduled rally, which was going to include his likely political opponent, Helena Bonanno Folks, in the 2026 gubernatorial Democratic primary, possibly Speaker Joe Shekarchi as well. That day, we did get a press release from the governor's office celebrating their involvement in this. They claimed there was a lot of sub rosa discussions with Brown on this matter. What was the first time that you heard from the governor's office, and how actively were they working with you hand in hand? And were you surprised to see that the governor and himself and nobody from the governor's office was attended that rally scheduled as it was prior to the decision, but the rally still occurred? What was your relationship with the governor's office?
Yeah, I know that a lot of the other politicians who had been working with us, namely Stephanie Smythe, who's one of our council women here in Newport, Cy, Representative Lauren Carson, were very, very instrumental in helping us convey our sentiments to Brown and lobbying them on our community's behalf. I had not actually directly heard from the governor's office, but again, I know that other people who were involved with our wider community coalition had.
Okay. In terms of where this goes from here, again, there's no promise that this won't come up in a year or two again, and that this may be, something that has to be revisited. What's your message to Brown in terms of a commitment to keep this birthing center open for the long term? And what do you think the community as a whole, I think a lot of people didn't know about this. I think there's a lot of people who would have been totally caught by surprise, or they were caught by surprise when they first heard about it. And then in fact, may have been so out of the loop that when perhaps they were going into labor, they said, well, let's go to Newport. Hypothetically, if the center closed, they would then find out, oh, by the way, there is no longer a birthing center at Newport Hospital. So how do you keep the pressure on Brown, and how do you create more community awareness that this could potentially pop up again as an issue?
Yeah, absolutely. Just to kind of speak to your point about people who were not planning to give birth at Newport Hospital. I have a friend of mine who shared her story during this whole process, and she was planning to give birth at Women and Infants in Providence. And when she actually went into labor the day of, she turned to her partner and she said, "I don't think I'm going to make it. I do not think I'm going to make it the 45 minutes to Providence to deliver this baby." And she ended up at Newport Hospital. So even if you're not planning to use Newport Hospital, it's still so essential that this service remains in our community for those who, like we've discussed previously, who do not have access to reliable transportation, who, may have, we serve a huge military community here in Newport, and sometimes those spouses are overseas. And so again, if you don't really know that many people in the area, you're stationed here, you move here kind of out of the blue, you don't really have a community besides the others in the military community here, having this hospital so close by is really, really essential. And the Navy base here in Newport no longer has a hospital on it that can deliver infants there. So again, all the military community that is stationed on Aquidneck Island does have to go to Newport Hospital to deliver their children. But in any event, as I shared the night of the rally last week, this right now from Brown University Health is a delay. It is not a commitment to our community. And the one thing that really struck me when I was first kind of digging into this and looking into this is obviously Brown University Health is a relatively new rebrand for Lifespan. And when they rebranded, Brown, made a multi-million-dollar commitment to the medical system, formerly known as Lifespan, for this. And what's really interesting to me is that this partnership between Brown University Medical School and the health system itself is really supposed to be hand in hand to better train the medical students, all of that. But on the medical school's page, their mission is to support the community, and their values that are stated are humanism, compassion, local community support, and accountability. And those are things that we really haven't seen very much of from Brown University Health throughout this process. And I think there is a huge values disconnect there between the values of the medical school at Brown University and the actions that Brown University Health has been taking here. And so I think that is another point that we need to, as a community, kind of further raise with the university itself, as well as their alum and medical students, is this real disconnect between the values of the school and the fact that Brown University's name is now on the health system, and really trying to reconcile that disconnect there.
Yeah, sometimes these things feel like they were crafted in a PR by a third party PR firm, and then they're deployed to sort of, create a narrative. But again, actions speak louder than words. And, it is, at the end of the day, it's what kind of world do you want to live in? We live in a privatized healthcare system that is, generally speaking, doctors and practitioners across the board, they have a mission that they're there for a reason, partially to make money, and oftentimes mostly because there's a soul calling that's happening. But corporations don't have community's best interests at heart by design. Do you think that we should revisit our entire healthcare system, and that it should be nationalized, that we should have a nationalized nonprofit model medical system? Has this experience kind of offered a window into how we might want to rebuild our world as a whole, so that these types of issues are truly based on community values and not based on profit? Or are you comfortable with the current system, just want to see some changes made that reflect the so-called mission statements that you identified there?
Ideally, we would all live in a world in which we all have each other's best interests at heart. Unfortunately, that is not the reality we live in. So I think instead of, kind of saying, I wish we had this system that was, nationally based, which I think would be, fantastic and would be great. I think we also have to operate within the reality that we're living in and advocate for change in the system where we can, while still at the same time continuing to put pressure on our politicians to go in a direction that's going to serve the national community at large in a better way. Because, as we're seeing here and as we're seeing across the country now with the legislation that has recently been passed, maternity care deserts are popping up all over the country, especially in rural areas or in island communities like ourselves. And so as a local community, I think it's incumbent upon us to do everything we can to speak up for what's right, to speak up for each other and have each other's backs here, but then also simultaneously put pressure on those who are in positions of power to advocate for a better way forward as well.
Yeah, pragmatism sometimes is the solution. Thanks for your work, and at least we're at a point now where this has been delayed at minimum, and hopefully this is a conversation that just goes away into the future.
Yeah, again, we will be here next year. We will continue fighting this fight. We are not looking for continued delays, but we're looking for a commitment to the Aquidneck Island community and to the mothers of Rhode Island at large.